It's been a little more than a week since President Biden signed into law the Inflation Reduction Act, taking historic steps to fight the climate crisis and also making major changes to our healthcare system not seen since the Affordable Care Act. Tonight, we're taking a closer look at what they could mean for your healthcare and family budget as key parts of the law now come into focus. Here's ABC's Devin Dwyer.
After decades of promises to curb skyrocketing costs, Democrats say relief from healthcare inflation is on the way, especially if you use prescription drugs.
This is a foot in the door for healthcare cost containment.
When will people start seeing the savings?
Starting next year, drug companies will be penalized if they increase prices faster than inflation.
Americans spend more on their prescriptions than anyone else in the world, on average $1,200 per person per year. When we met Laura Marston last year in D.C.,
most of these vials are expired.
We saw firsthand how the soaring price of insulin these days,
which is around $300 a vial,
means having to save every last drop.
I feel like I live in a country that prides itself on freedom, but I don't get to be free because at 14, I was diagnosed as a type 1 diabetic.
Starting next year, millions of diabetics on Medicare will pay no more than $35 a month for insulin. Good news for retirees like Sue Milliken.
I don't think anybody's happy with how drug prices have gone up.
The Ohio grandmother says drug price inflation has been eating away at her fixed income.
And the other drugs that I'm on have gotten very expensive. On blood thinners, on certain cholesterol medicine I've been on, they've been in the $200 to $400 range.
But under provisions of the Inflation Reduction Act, by 2025, Sue and 50 million other American seniors won't pay more than $2,000 a year for all their prescription drugs combined.
This cap on out-of-pocket costs for drugs will help the sickest people on Medicare. So these are people with cancer, people with HIV, people with blood diseases. The cost can really run up quickly if you're taking these expensive drugs, and this legislation will provide relief.
The law also means big savings for taxpayers, an estimated $288 billion over the next decade, thanks to government now being able to negotiate down some drug prices for the first time starting in 2026.
Everyone would feel it through a couple different channels. In some cases, it would mean less out of pocket at the pharmacy. In some other cases, it would mean less that we'd pay for prescription drug coverage.
The motion is adopted.
It's a historic change embraced by large majorities of Democrats, Republicans, and independents, even as drug companies lobbied hard against it.
This Inflation Reduction Act is a lie.
And every Republican lawmaker voted no.
We want to allow innovation. I'm a doctor, so the fact that people can't afford their insulin, I am very aware of. I'm also very aware that part of the price inflation when it comes to insulin is not the price coming from the drug company, but rather the extra price added by the pharmacy benefit manager.
Of course, we make profit, but it's not like we keep it, right? We return it to shareholders who give us money to take huge risk on R&D.
Lilly CEO Dave Ricks told us last year, though the company makes billions in profit, government-mandated lower prices will soon mean fewer experimental drugs coming to market.
5 of the 6 medicines approved globally to treat COVID are from American companies, 2 from mine, and 3 out of the 3 vaccines that are used globally are from American companies.
One independent analysis forecasts there will be 2 fewer drugs developed over the next 10 years because of the law, and that launch prices of some new drugs could be much higher.
I can see where it's happened in other countries where it limits how many drugs they get, when they get them, how fast you can get stuff. And I don't want to see that happen here.
What we really don't know is which drugs might not come to market as a result of lower prices. Will it be groundbreaking treatments or, just Me Too drugs that don't really offer a whole lot of improved health?
For Laura Marston, the law is a major milestone, but with limited impact.
As a patient who depends on insulin to survive, it wasn't as fantastic for us.
That's because most Americans not on Medicare won't see any immediate change at the pharmacy. Those on private health insurance like Marston could still see prices climb sharply.
Over $2,000 worth of insulin.
1 in 5 insulin users pay over $35 a month for their supply, and that new $35 monthly cap won't apply for most of them.
Health insurance is not guaranteed. but I need insulin without a doubt for the rest of my life. I really implore Congress to seek out and introduce solutions that help diabetics and patients across the board.
With the midterms approaching, further quick action by Congress is a long shot. Some states are acting on their own. 22 have capped insulin copays, but only for those on state insurance plans.
Remains to be seen whether Democrats are able to build on this and expand the scope.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.